Many independent medical practices today operate in a state of divided reality. The clinical side, the actual patient care, is often thriving, but the digital administrative backend running the practice is stretching to a breaking point. For thousands of mid-sized practices, that digital engine is Athenahealth. It is powerful, award-winning software, but operating it correctly requires a massive, consistent human effort to manage daily task queues. This chart tracks healthcare administrative staffing. According to MGMA, front office support staff hit a 40% turnover rate in 2022. Business operations and billing faced 33% turnover. Data confirms these roles remain primary hotspots. The revolving door slowed slightly, but hasn't stopped. When those seats sit empty, the downstream effects are immediate. Incoming calls go unanswered. Outreach for care gaps stops. Prior authorizations stall, and appointment scheduling falls behind. Relying on a fragile local labor pool to run complex EHR software has become the defining operational bottleneck for the independent practice. Beyond the daily frustration of an empty desk, that turnover inflicts a quantifiable financial cost that directly erodes practice margins. This gauge illustrates the penalty of losing an administrative employee. For a typical $35,000 hire, replacement costs reach an additional $25,000 to $35,000. These stem from job advertising, lost productivity, and 16 hours of HR processing time. Then you face the ramp-up lag. Even after basic onboarding, it typically takes a new local hire 60 to 90 days to achieve genuine proficiency in a practice's specific Athenahealth workflows. This creates a staffing spiral. One vacancy forces the remaining staff to absorb extra work. Morale drops, errors increase, and that stress often triggers the next resignation. The cycle of posting a job, training a generalist, and losing that knowledge a year later is a broken financial model that guarantees negative operational output. Managing Athenahealth tasks is rarely a technology problem you can fix with IT. It is a labor mismatch. The software requires specialized, uninterrupted throughput that most front offices aren't structured to provide. The sheer volume of human effort required is staggering. The American Medical Association reports that physicians and their staff spend an average of 14 hours a week doing nothing but seeking prior authorizations. Success in Athenahealth requires dedicated ownership of workflows, routine auditing, and same-day documentation. Local generalists who are constantly interrupted by physical patient check-ins struggle to maintain that consistency. To solve this, practices are migrating the entire Athenahealth function to dedicated offshore virtual medical assistants, or VMAs, through Staffingly. This move involves an operational trade-off. You surrender the convenience of physical tap-on-the-shoulder oversight in the office in exchange for specialized, uninterrupted remote focus on your digital task queues. Stabilizing a practice requires treating EHR management as a specialized digital supply chain, rather than a secondary duty for the local front desk. When you compare the loaded cost of local generalists against dedicated remote specialists, the financial data is clear. If you look at this comparative cost matrix, you see the fully loaded annual cost of one in-house hire. Base salary is only the starting point. Once you add payroll taxes, benefits, overhead, and training, that single seat costs approximately $60,800 a year. Compare that to the Staffingly VMA model. Because it is a flat monthly rate, employer liabilities like payroll taxes and benefits are removed. The annual cost is $21,600, representing a 64% reduction in overhead. Beyond the price, this model addresses the single biggest operational risk of local staffing, the empty desk caused by sick days or abrupt resignations. Staffingly provides built-in backup coverage at no additional charge. If your dedicated VMA is unavailable, a trained backup steps in immediately. Your task queues never stall. While the 64% cost reduction is significant, the primary benefit is the shift from unpredictable local vacancies to a system of managed, continuous coverage. Practice managers are often skeptical regarding the accuracy and compliance of remote offshore teams. Security is addressed through a non-negotiable baseline. Staffingly operates under strict HIPAA, SOC 2 Type 2, ISO 27001, and HITRS certifications, with all team members working via encrypted connections. This flowchart illustrates how Staffingly achieves sub 1% error rates. They augment human VMAs with AI automation. Raw Athenahealth tasks enter the system, and intelligent routing matches each task to the specific human specialist with the best track record for that workflow. Simultaneously, anomaly detection uses machine learning to flag unusual coding patterns or missing data, catching potential errors before they turn into costly claim denials. Practice leaders maintain visibility through daily reporting dashboards. These replace physical oversight with data-driven transparency, showing you exactly how many tasks were processed and where errors were caught. Combining dedicated human focus with AI quality control creates an operational engine that becomes more efficient the longer it runs. Deciding to move to a remote workflow model depends on how your practice balances its physical and digital needs. This model is not a fit for practices that need a single person to handle both physical patient rooming and the heavy digital backend work. However, it is a direct solution for independent and mid-sized practices caught in a staffing spiral, drowning in prior authorizations, and losing margin to administrative turnover. For qualified practices, deployment of a remote team is fast. A dedicated API-connected VMA can begin processing your task queues within 48 to 72 hours of kickoff. The smartest modern practices are dividing their labor. They keep physical patient care strictly in-house, while migrating all digital workflows to specialized remote teams. The human cost of healthcare administration is currently too high and too unpredictable to manage through a generalized local staffing model. Maintaining the status quo means accepting chronic operational anxiety and $35,000 turnover hits as a standard cost of doing business. The Staffingly model offers a proven alternative: stabilized Athenahealth operations, certified compliance, and a 64% reduction in overhead. Stop managing staffing crises. Book a free discovery call or start the 2-week risk-free pilot at staffingly.com/demo.